One of the challenges for men and their loved ones when considering their treatment options for prostate cancer include navigating potential side effects with treatment. I'm excited to be introducing a new and innovative technology today to our listeners that can help in reducing potential short and long-term side effects of radiation therapy for prostate cancer. You'll be getting to meet one of the key opinion leaders in the field to get you up to speed. So listen in. So the big question is this: how can men and those who care for them better educate themselves regarding prostate health, the conditions that affect the prostate, and the latest technology in managing these conditions? That is the question, and this podcast will provide the answers. On the podcast, we'll be chatting with experts, innovators, and leaders in the field of urology, sharing useful information with the general public to improve their lives and increase their overall health. My name is Dr. Garrett Pohlman, and welcome to the Prostate Health Podcast. Prostate Health Podcast is for informational purposes only. Nothing in this podcast should be construed as medical advice. By listening to the podcast, no physician-patient relationship has been formed. For more information and counseling, you must contact your personal physician or urologist with questions about your unique situation. Today, the Prostate Health Podcast is excited to be partnering with BioProtect to bring you our esteemed guest, Radiation Oncologist, Dr. Jonathan Tward, who is a tenured professor in the Department of Radiation Oncology at the University of Utah Health. He is recognized as a major authority and key opinion leader in managing prostate cancer. His education includes a Ph.D. in biochemistry at UCLA, medical degree at Tufts University in Boston, and radiation oncology residency training at the University of Utah. He holds the Vincent P. and Manzini Presidential Endowed Chair at Huntsman Cancer Institute in genitourinary malignancies. He is an expert at delivering highly precise and targeted radiation therapy for numerous genitourinary malignancies, including prostate cancer. He utilizes the vast array of technologies available to deliver intensity-modulated radiotherapy, image-guided radiotherapy, stereotactic body radiotherapy, as well as low-dose rate and high-dose rate brachytherapy. He has contributed to over 100 published peer-reviewed journal articles and serves on the National Comprehensive Cancer Network's Clinical Practice Guidelines Committees for prostate, bladder, and penile cancers. Dr. Tward, welcome to the Prostate Health Podcast.
Thank you so much. I certainly appreciate the invitation to be here.
One of the challenges of both surgery and radiation therapy for prostate cancer include navigating potential risks and side effects of therapy. When counseling men and their loved ones regarding radiation therapy, what are some of the potential risks to consider?
Yeah, that's a great question. The risks of any kind of prostate-directed therapy, whether you're talking about radiation or surgery, are primarily those that relate to sexual function, urinary function, and bowel function. So it's a similar discussion that a patient might have in a radiation oncologist's office as that in a urologist's office. And I think, though, that maybe one of the more unique side effects that we're concerned about is potential risk to bowel injury. I think a surgeon has an advantage of staying away from the rectum during their surgical dissections, assuming they're well trained and good at their job. But the very nature of passing beams into people includes passing them through the rectum or the bladder, or even when you're doing brachytherapy techniques, you still can get dose to the rectum. And since it is so close to the bottom of the prostate, literally millimeters away, I think that it deserves special attention when we're talking about radiation therapies.
Well, and over the years, urologists and radiation oncologists continue to seek out strategies in minimizing the toxicity of treatment without sacrificing cancer control. With continued innovative advances in technology, we now have more tools at our disposal to help patients in establishing excellent treatment outcomes. Now, what have been some of the more recent advances in the field of radiation oncology in minimizing the potential toxicity of therapy?
Yeah, it's a really great question because technological changes in radiation therapy specifically have really bent the needle on risk of radiation injury, really starting about 20 years ago. And there's sort of like a spectrum of innovation. But if we're just talking about the last 20 years, one of the biggest innovations was the development of what we call intensity modulated radiation therapy. This was techniques that really allowed us to start painting our dose where we want. And that made a big difference in moving patients from always having rectal bother to sometimes having rectal bother. And even though with modern radiation techniques and image-guided radiation therapy, we can safely get patients through this treatment with a very low risk of rectal injury, we want to make that risk go from very low to non-existent. And so the actual major innovation in that sphere happened about 8 years ago when rectal spacing products first came onto the market. And what those were products that we could insert between the rectum and the prostate gland and create a physical space that isn't there naturally. And radiation oncologists work on millimeters, actually. Like, we're so good at directing our beams to within millimeters of where we want that we can mitigate some of that risk. But even so, that rectum is just a millimeter or two away from the prostate gland. So creating additional space would go a long way to mitigate any kind of rectal toxicity. And what these spacers did was allow us to create a physical barrier that moves the rectum away and at the same time is temporary. So we would place these spacers, and usually they would dwell there for several months and then dissipate. And that took the small chance of rectal irritation and injury and made it close to zero. Unfortunately, the initial products that came onto the market, although very effective and still commonly used today, in of themselves can carry a risk of injury because when you place them, you use sharp needles, and sharp needles can actually inadvertently go into the rectum. So one of the concerns about the first generation products are that you could accidentally put the spacing material where you don't want it, like within the rectum itself. And if that were to occur, you could get some pretty devastating injuries. For example, although rare, you could have something called a fistula, where you'd get an improper connection between the rectum and the bladder or the urethra. And those can be very painful. They can take a long time to heal. And in worst case scenarios, might even result in losing your bladder or your rectum. So there's a paradox that you're placing a product to protect the rectum that in rare circumstances can lead to very devastating injuries, or maybe if you misplace it, could also lead to a delay in cancer treatment while you're waiting for those products to dissipate and that injury to heal. In either case, there's some additional risk. What's interesting, though, about the most recent development is just a few months ago, the FDA approved a new spacer product that I like to think of as the next generation or newest generation of rectal spacing. And the reason I'm excited to actually talk to you about it is that I think it almost completely mitigates the risk of these severe injuries like fistula by the very nature of how we insert them. But equally and also importantly, they are much more consistent at providing the space you want and making sure the space is the height you want. And because they are physically constrained by a balloon, they will go exactly where you want them to be, whereas the other products on the market may inadvertently go somewhere else because they're semi-liquid is maybe the way to think of it. And they don't always go where you want. And so you can be dissatisfied with the space that you achieve.
Well, and as you mentioned, here in August of 2023, the FDA cleared the BioProtect balloon implant system for use during prostate cancer radiation. Dr. Tward, could you explain to our listeners what is the BioProtect balloon implant system?
Yeah, so the BioProtect balloon system is this newest generation device, and it's exactly what its name implies. It's an actual balloon that you place underneath the prostate gland and above the rectum, and you fill that balloon with sterile salt water, and most of your body and cells are just salt water. But because you're filling an actual balloon, it constrains the salt water to exactly where you want it to be. And you can use this balloon to create almost any size lift you want. And routinely, we will fill it to be about a 14 millimeter to 18 millimeter height off of the rectum. As I might have mentioned in my previous answer, we have been able to put non-balloon style spacers in people for many years. However, it's unlikely that you can get a space as high as 17 millimeters although maybe on occasion you might. But one of the problems with a spacer that is not constrained by a balloon is that sometimes injectable products go where they may. And in my experience, and I've put in many, many hundreds of spacers, all of the FDA approved products are ones I'm well experienced with. What I've noted is that an experienced user can often get what's I'd say is a satisfying space with one of the non-balloon products, but you seldom get a near perfect or perfect space. And one thing that impressed me so much actually about the BioProtect system is that my first 10 cases with that implant system, I felt created a better space and more reliable and central location than maybe my 10 best cases with the products that I've done hundreds of repetitions in. And that really caught my attention. And as I alluded to earlier, it's unusual, but there's a risk of creating an injury anytime you stick something inside a person. But the nature of how you place these balloons is such that injuring the rectum would be very, very, very low. And that's because you don't use what we call sharp dissections or needles that could go anywhere tissue is. But as awful as this term is, we use a blunt dissection. And what a blunt dissection does is it relies on the natural tendencies of tissues that are willing to separate. With the introduction of a little bit of pressure, they'll naturally separate. It doesn't rely on knife edges or needle bevels. And it just is lucky that the body is such that we could use blunt dissection to separate the prostate away from the rectum. However, it would be very difficult to bluntly dissect into the rectum itself. So the safety profile was remarkable to me. The consistency and reliability of the placement of the space was remarkable to me. And one additional thing worth mentioning is you could reposition it during the insertion. So if you didn't really like precisely how you placed it on your first inflation, you could deflate the balloon, move it over, and reinflate it. So I think it's really taken some of the concerns or limitations of the earlier products and addressed them.
Well, you are certainly a key opinion leader in the radiation oncology space when it comes to new advances in the field. Could you highlight your own initial clinical experience with this new technology, including comparing it to the previous generations of rectal spacers?
Yeah, so I think all of the rectal spacing products on the market do a good job of providing some space. But as I might have alluded to in the last answer, you will get a very consistent result with the new product because you truly can position it exactly where you want. And there's no concern about it going anywhere you didn't intend. With the other products that are on the market, sometimes it goes off to the side and doesn't give you the space that you're looking for, the lift away from the rectum. Or sometimes, or say 100% of the time, you can't reposition the spacer after you have inserted the product. So there are very, very clear advantages to the new product. And the other thing that I think is worth saying is that I personally actually find it easier and less time consuming to insert into a patient. And that may seem paradoxical considering we're inflating a device and things of that nature, but the actual placement is very, very straightforward. The only significant difference, I think, in terms of the patient experience, frankly, is that with this device, you have to make a very small incision in the skin as opposed to the prior generation products where you put them in with just a needle. But this incision is so small that I routinely just close the incision with something like a medical superglue called Dermabond, and have never needed to put, for instance, a suture or a stitch into a patient. But some people who do place these devices might put a single stitch in. And maybe I didn't mention some other comparisons and contrasts, but this particular balloon is designed to be stable in the body for about 4 months before it completely degrades. But if for some reason I decided I wanted it to deflate sooner, I theoretically could put a needle in it and take the solution out anytime I want. I have colleagues who do brachytherapy in one day, and they have mentioned to me that they've delivered their high dose rate brachytherapy and then put the balloon down at the end of the day. And that's not something you can do with the other products. The range of how long the other products dwell in the patient are anywhere from 6 months to a year or more. So even this is a difference between the other products.
I know our listeners would be curious to get your thoughts on who is a good candidate for the BioProtect balloon implant system.
Yeah, so in my practice, I use rectal spacers in anybody with an intact prostate that is going to be receiving radiation therapy. And I don't think it makes a difference whether or not they're getting stereotactic body radiation therapy, which is 5 treatments, or if they're getting 44 treatments. I'll put it in patients getting high dose rate brachytherapy, low dose rate brachytherapy. And the reason is that radiation is radiation. So if you're radiating a patient, you want to protect the rectum. The patients, though, that are not good candidates for the balloon are uncommon, or any spacing device, I should say. And those would be people that have very advanced cancers where maybe the cancer has grown into the rectum and is touching it. We wouldn't want to sort of separate the cancer and leave some on the rectal surface and not radiate it. So those are unusual circumstances where I wouldn't want to place a rectal spacer. I also think that there are patients who've had, for whatever reason, prior surgeries in the area or traumas, and patients with those histories sometimes have scarring and scar tissue that makes it very difficult to create a space, whether or not you're using sharp dissection or blunt dissection. The tissues are kind of sticky and adhered, and you might end up doing more damage to a patient by trying to open a space that doesn't want to move than leaving them alone. So that's a small percentage of patients. And the last group of patients that I might be reluctant to place a spacer into are those who, for maybe serious cardiac reasons or blood clotting reasons, are on anticoagulant therapies that their other doctors think it might be unsafe even for a few days to stop. That is a very uncommon patient, as Dr. Pohlman. There's lots of patients that are on anticoagulation therapies, and it's usually okay to stop those for a few days. But there's a small group of patients where if you don't want any risk of introducing a needle or an incision and bleeding, then we might avoid that. But the reality is that I'd say 95% of patients who are candidates for radiation therapy are likely to be candidates for a spacing product.
Now, what are some of the outcomes reported with the BioProtect system, looking back at some of the highlights of the data that got the FDA approval?
Yeah, so I could answer it specifically for the BioProtect, and I could also answer it for the category in general. So maybe starting at the category level, when spacing products came on the market, randomized trials were performed that looked at patient-reported quality of life, physician-graded toxicity, and also sort of dosimetry metrics, or let's call it radiation things we can look at that correlate with risk of injury. And I think all the spacing products on the market have demonstrated very well that they can reduce the exposure of radiation to the rectum. And when we talk about that outcome, the way we measure risk of injury is by looking at this unusual metric called the volume of the rectum that receives 70 gray or more of radiation. And gray is just a radiation dose. And it's also important to say that that's 70 gray is when you're talking about something called conventionally fractured radiation. But we can look at what percentage of the rectum gets this dose and correlate that with increasing risk of toxicity. And radiation oncologists get very, very nervous when the volume of rectum getting 70 gray or more is more than, let's say, 15%. That's when risk goes up very high. But even at lower volumes getting 70 gray, there's some risk. And if you look at the BioProtect device itself, it reduces the volume of the rectum getting 70 gray to 1%. That is so low that there's almost no appreciable risk of radiation injury. So that's one of the most important outcomes that we can measure. But in general, as a category, patients, and this is the most important thing, say that when spacers are placed, their quality of life is much more likely to be maintained, not just in the short term, but in the long term. And so that's really the thing that I think we have to focus on. which is it's one thing to talk about weird statistics and volumes of rectums getting weird radiation doses, but all that really matters is what a patient says is happening to them. And they routinely, for the category, say their quality of life is improved. And so I think it stands to reason that this newer device, because you can get better space, control this space, ensure that it gets where you want, are possibly more likely to have even better outcomes than those reported from the other products. But I want to be very careful to say that they have not been tested head to head. What I just said is conjecture in terms of quality of life. But the fact that it is so reliable and so reproducible leads me to believe that it in no way would be worse and almost certainly will have a higher probability of ensuring we protect patient quality of life.
Now, when counseling patients, what are some of the potential side effects or risks of the procedure for them to be aware of?
Yeah, I think the biggest risk of any procedure where you're either sticking a needle in the perineum or making a small incision, the number one risk is infection. So we have to be very careful to make sure we do this using great sterile techniques. So I always let patients know that there's a small risk of infection, and we abrogate that risk by giving the patients antibiotics before the procedure starts and maybe for a day or two afterward in certain cases. But the actual patient experience, which is a risk in of itself, it's important to say that if I was one of your patients listening to the podcast, I'm going to be like, they're going to stick a needle in my perineum or a little catheter in there. Surely that will be uncomfortable. But interestingly enough, it's really not. These procedures can be done under local anesthesia. They could also be done under a sedation kind of anesthesia, kind of like if one's had a colonoscopy, you could make someone basically be asleep. Regardless of if you're doing it using a local nerve block or a sedation kind of methodology, my experience with this particular product, as well as the prior generation of products, is that it is actually not at all uncomfortable for the patient, or maybe better said, minimally uncomfortable during the time you're placing these products. And so I've asked every one of my patients after every kind of procedure where I'm sticking a needle or making an incision in the rectum, what's the worst, not the rectum rather, but the perineum, what's the worst pain they might have felt during the procedure? I think the highest number I've ever heard from a patient is 3 on a 0 to 10 scale, with 10 being the worst pain they imagine. I think most patients, if they're doing it under local anesthesia, would say maybe for an instantaneous second, they might have a level 2 kind of discomfort. But I also think that when spacers are being placed under the rectum, the patient might feel a little bit of sort of fullness or a feeling like they might have to poop. And that's not uncommon for someone to report, but typically when they feel that, it only lasts for maybe an hour or 2 or 3. It's unusual to be more than a day and highly unusual for more than 2 or 3 days. And that's kind of the common experience. But I want to go back to the devastating risk that might happen if you were to accidentally put a spacing product into the rectal wall itself. And again, even though it's rare, you can get ulcers and fistulas when that happens. And if you look at the product literature, not the product literature, but the toxicity reports that have come out for products that have already been on the market, one might expect that about anywhere from 1 in 150 to 1 in 300 patients might end up with a severe rectal ulcer or fistula. And to me, that is a devastating complication that I'm trying to avoid. And I think that the nature of this product, using this so-called blunt dissection, should make that almost impossible. It's hard to imagine how we can accidentally enter the rectal wall when we're not using sharp dissection.
Well, it is certainly exciting to have a new innovative system with the BioProtect balloon implant system in our arsenal as we treat prostate cancer to really help in minimizing potential side effects of therapy without sacrificing cancer treatment outcomes. Dr. Tward, any final thoughts today for our listeners?
Yeah, I think the final thoughts in general for the listeners is the following issue. If you've been diagnosed with localized prostate cancer, you are being faced with a myriad of choices. And that's what makes it very difficult as a patient to kind of decide what's sort of the best treatment for me, what are the best interventions for me. It's why it's so important that you speak to your urologist, you speak to your radiation oncologist, and you really ask them questions about the details of the procedures that they're planning on doing and recommending. And I think if you're going to be speaking to a radiation oncologist about radiation therapy options, it is certainly worth inquiring whether or not they put rectal spacers into their patients to try to protect their rectum. And if so, potentially which products they'd use and why they are choosing those particular products. I think that at the end of the day, a patient and their doctor have to highly individualize their treatment for their individual situation. And there is no one size fits all answer to this. But if we're, I guess, talking about the BioProtect spacing system, it is hard for me to imagine why I wouldn't want to use this particular spacer when I am thinking about making it safer for patients to get radiation therapy.
Well, it was certainly a pleasure getting to chat with you today on the Prostate Health Podcast. We really appreciate you taking time out of your busy schedule today to visit with us. You've given tremendous value to our listeners and really helping empower them. Thank you again.
It's my pleasure. Thanks again.
Thank you again for listening to the Prostate Health Podcast. For those of you wanting to dive in even deeper, make sure to check out the Prostate Health Academy, which offers comprehensive and easy to navigate lessons that I have prepared for you. There's also an active private community forum, and I am there every day providing support, insight, and answering questions. To learn more, just go to www.prostatehealthacademy.com and click on Join Now. Well, that's it for today. We will see you at the next episode.